ASCP practice questions of the day. In this video we will review 10 ASCP-style practice questions composed of different MLS subjects to prepare for the exam. Let's start now. A 25-year-old patient presents with fatigue and pallor. Laboratory results show hemoglobin, 8.5 grams per deciliter. MCV, 68 FL. RDW, increased. Peripheral smear, microcytic, hypochromic RBCs. What is the most likely diagnosis? A. Thalassemia minor. B. Iron deficiency anemia. C. Anemia of chronic disease. D. Sideroblastic anemia. Correct answer. B. Iron deficiency anemia. Explanation. Iron deficiency anemia typically presents with low MCV, microcytic, low hemoglobin, and increased RDW due to variation in RBC size. In contrast, thalassemia minor usually has a normal RDW and a higher RBC count. A patient with uncontrolled diabetes mellitus presents with the following laboratory results. Glucose, 480 mg per deciliter. Arterial pH, 7.25. Hydrogen carbonate, 15 milliequivalent per liter. Positive serum ketones. Which acid-base imbalance is most consistent with these findings? A. Metabolic alkalosis. B. Respiratory acidosis. C. Metabolic acidosis. D. Respiratory alkalosis. Correct answer. C. Metabolic acidosis. Explanation. This patient shows classic findings of diabetic ketoacidosis, DKA, low pH, acidic, low bicarbonate, hydrogen carbonate, elevated glucose. Positive ketones. DKA causes metabolic acidosis due to accumulation of keto acids. The low bicarbonate confirms a metabolic, not respiratory, cause. A patient's antibody screen is positive. The antibody identification panel shows reactions with cells that are E positive, C positive, K negative. The autocontrol is negative. Which antibody is most likely present? A. Anti-K. B. Anti-E. C. Anti-C. D. Anti-D. Correct answer. B. Anti-E. Explanation. The antibody reacts only with cells that are E positive. K negative rules out anti-K. If C were the cause, reactions would correlate only with C positive cells. No information suggests anti-D. Since the reaction pattern matches E positive cells, the most likely antibody is anti-E. The negative autocontrol suggests this is an allo-antibody, not an autoantibody. A sputum culture grows gram-positive cocci in clusters. The organism is catalase positive and coagulase positive. Which organism is most likely identified? A. Staphylococcus epidermidis. B. Staphylococcus aureus. C. Streptococcus pneumoniae. D. Enterococcus faecalis. Correct answer. B. Staphylococcus aureus. Explanation. Gram-positive cocci in clusters. Think Staphylococcus species. Catalase positive. Confirms Staphylococcus, not Streptococcus. Coagulase positive. Only Staphylococcus aureus is coagulase positive. Staphylococcus epidermidis is catalase positive but coagulase negative. A 55-year-old patient presents with fatigue and splenomegaly. CBC results show WBC, 85 × 10⁹ per liter. Hemoglobin, 10.5 grams per deciliter. Platelets, 520 × 10⁹ per liter. Peripheral smear. Marked left shift with myelocytes, metamyelocytes, and occasional blasts. Which laboratory test would confirm the suspected diagnosis? A. JAK2 mutation analysis. B. BCR-ABL1 testing. C. Flow cytometry for CD5, CD23D serum erythropoietin level. Correct answer. BCR-ABL1 testing. Explanation. The marked leukocytosis with a left shift, myelocytes, metamyelocytes, and splenomegaly strongly suggest chronic myelogenous leukemia, CML. CML is characterized by the Philadelphia chromosome, which produces the BCR-ABL1 fusion gene. JAK2, associated with polycythemia vera, ET, and primary myelofibrosis. CD5, CD23. Seen in CLL. Erythropoietin. Used in evaluating polycythemia. A patient presents with easy bruising and prolonged bleeding after minor cuts. Laboratory results show PT, normal, APTT, prolonged, platelet count, normal, bleeding time, normal. Which factor deficiency is most likely? A. Factor 7 deficiency. B. Factor 8 deficiency. C. Factor 10 deficiency. D. Factor 5 deficiency. Correct answer. B. Factor 8 deficiency. Explanation. Normal PT. Extrinsic pathway is normal. Prolonged APTT. Intrinsic pathway defect. Normal platelets and bleeding time, not a platelet disorder. Factor 8 belongs to the intrinsic pathway, so its deficiency prolongs APTT only. This pattern is classic for hemophilia A. A patient presents with prolonged bleeding after surgery. Laboratory results show PT, normal, APTT, prolonged, platelet count, normal. A 1-to-1 mixing study with normal plasma is performed. The APTT corrects to normal immediately and remains corrected after incubation. What is the most likely cause? A. Lupus anticoagulant. B. Factor 8 inhibitor. C. Factor 9 deficiency. D. Heparin therapy. Correct answer. C. Factor 9 deficiency. Explanation. When a mixing study corrects immediately and stays corrected after incubation, it indicates a factor deficiency, not an inhibitor. Since PT is normal, APTT is prolonged. The defect is in the intrinsic pathway, factors 12, 11, 9, 8. A patient's antibody screen is positive. An antibody identification panel shows the following pattern. All cells are negative at immediate spin. Positive reactions at AHG phase. All positive cells are FYA positive. Autocontrol is negative. Which antibody is most likely present? A. Anti-D. B. Anti-K. C. Anti-FYA. D. Anti-M. Correct answer. C. Anti-FYA. Explanation. Reactions occur only at the AHG phase. IgG antibody. All reacting cells are FYA positive. Autocontrol is negative. Allantibody, not autoantibody. The Duffy antibody anti-FYA is an IgG antibody that reacts at AHG and follows this pattern. A patient requires transfusion. The following results are obtained. ABO-RH, a positive. Antibody screen, negative. Crossmatch, AHG phase, incompatible with 2 out of 3 donor units. Autocontrol, negative. What is the most likely explanation? A. ABO incompatibility. B. Allantibody to a low-incidence antigen. C. Warm autoantibody. D. Cold agglutinin. Correct answer. B. Allantibody to a low-incidence antigen. Explanation. Antibody screen is negative. No antibodies detected in screening cells. Some donor units incompatible. Suggests antibody reacting with an antigen present only on certain donor cells. Autocontrol negative. Not an autoantibody. This pattern strongly suggests an alloantibody against a low-incidence antigen that was not present on screening cells but present on some donor units. A patient with HIV presents with headache and fever. A CSF specimen is submitted to the laboratory. India ink preparation reveals encapsulated budding yeast. Which organism is most likely identified? A. Candida albicans. B. Cryptococcus neoformans. C. Histoplasma capsulatum. D. Blastomyces dermatitis. Correct answer. B. Cryptococcus neoformans. Explanation. Immunocompromised patient, HIV, CSF involvement. Encapsulated budding yeast, India ink positive. These findings are classic for Cryptococcus neoformans, which has a thick polysaccharide capsule visible with India ink. Great job reviewing these ASCP practice questions. If you found this helpful, please like the video, subscribe to the channel and turn on the notification bell for more medical laboratory science review content. See you in the next quiz.